So, good afternoon. My name is Rianana Pineda, and my objective for today is to provide a procedure which is hot compress to the patient. So, good afternoon, sir. I will be your student nurse for today. So, could you please state your name, your birthday, and your age?
Darren P. Antonio, February 22, 2007, so I am currently 19 years old.
So, let me check your ID band, sir. Thank you. So, we can also verify it to the previous medical history of the patient to the hospital. So, next is I'll be verifying it to the doctor's or physician's order if what type of cold compress, hot compress will be going to use, and the duration, if how long, so that we can prevent errors. So next is I will be reviewing the medical history of the patient, and next is I'll be assessing the site if there's any presence of sensitivity in the affected area. So I'm just going to expose it. Okay, thank you, sir. So the affected area of Sir Darrell is in the lower leg, which we will be going to put a hot compress since there's a mild pain around the area. So I will be doing next is to inspect the color, the size, and the discharge around the area if there's any wound that is present. And I'll be checking the temperature of the patient, because it can indicate that the patient can have an infection if the site is swelling or there's a presence of infection. So, okay, thank you, sir. So next is we'll be going to discuss or explain the procedure to the patient. So, but before that, I'm going to explain it to the family of the patient to enhance their understanding about the procedure and for safety factors to the patient. So I'll be answering, and I'll be giving an explanation to the family of the patient. So next, I'll be going to discuss it to the patient and ask for consent. So today, sir, we'll be going to put a hot compress. So is that okay with you po? To boost the circulation around the site and provide you a comfort. Okay, thank you. So now we'll be going to hand hygiene. And put a gloves to prevent transmission of microorganisms. Then after that, we put gloves. We'll be going to place a waterproof undercut to the patient, and we're going to arrange the or assemble the equipments to easily get it. So now we'll be going to place waterproof undercut, and then I'll be going to put the the hot compress, but it should not be too hot to the patient so that it prevent from tissue damage. So I'm going to put it here on the just right temperature, and then I'm going squeeze it so that the moisture will come out, and then I'm going to press it gently to the side, and going to ask the patient, do you feel any discomfort, sir? Okay, thank you. Then after that is I'm going to discard all the necessary equipments to help the patient to get into comfortable. So, okay, sir, you can now go to comfortable position. And then next is I'm going to discard it to the yellow trash bin, and also this one, and then perform hand hygiene, and then put it to the comfortable position. Okay. And then next is I'm going to document if there's any unexpected outcomes that can occur, and previously we should stop we should stop the hot compress if the patient feel too much sensitive around the area, and then I will refer it to the physician. So that's it. Thank you.